Thanks for staying tuned. In the interview segment, the Chief Consultant Epidemiologist at the Ministry of Health, Dr. Godwin Ntadom, speaks about some of the facts and myths about the coronavirus. Dr. Godwin Ntadom, thank you very much for coming on Dateline Abuja.
My pleasure.
By the way, Dr. Ntadom is a Chief Consultant Epidemiologist from the Federal Ministry of Health. Coronavirus, so much information we've heard since the outbreak of that disease, but let's quickly get an update. We have one index case, some people are quarantined, but no fresh cases yet. Is there any update?
Still remain the same. The update is still one person, the index case, and all the other individuals that have been quarantined, and a few others that were not traced. That they've not been able to trace, and the efforts are going on to use all available means to get in touch with those individuals. Yeah.
So I'm saying this, that's sort of good news if we still have just one index case and no fresh outbreak.
Yeah.
Is this as a result of something spectacular we have done in tackling the issue, or we're just plain lucky?
Well, two things, because if we are thinking about being lucky, if there had been any other case, probably the airport would have picked it, because as I'm talking, and a lot of things have gone into play from the Federal Ministry of Health, the state ministries of health, the agencies, NCDC, everybody is working.
From the medical point of view, is it almost certain, almost automatic that if anyone has that virus, I do know that they say sometimes it probably won't manifest, maybe a day, 2 or 3.
It's
so
true.
Those first few days, would you necessarily present a high temperature?
No, it has an incubation period. It may not begin with, well, if it's the first day of infection, you may not actually have temperature.
But that's all we gauge at the airport, isn't it? It's the first thing we look at.
And that is why we are not only looking, if you are coming from any country that has had a case or has been recorded to have a case, you are followed up. So you are followed up, they collect all your contacts. And the good thing is that to help yourself and to help your family also, if, for instance, you are coming from the US is already one of the countries with cases, and you come into the country, you should be aware that it is possible for you to develop the symptoms. And like it is now, most doctors in the past, when you come with fever, cough, the first thing that goes into their mind is malaria. Is no longer like that. If you come just on a lighter mood, I was in a place where somebody coughed and coughed again. Then somebody started the song, Baba Oluwa Gbawa Lowo Koro. In Yoruba, just embarrassing, of course, but again, what he's telling us is that somebody is coughing. You are aware that this person may have, and if you are an individual that just traveled and you are in the country, you don't need to wait for them to call you. You can show up. I came from maybe this country, and there is an outbreak or so, and so. I want to be tested. You do it voluntarily. And like has been said again, if you are from a country with this cases, you can do self-isolation. You go stay in your house to ensure you stay between up to 14 days. Don't mix with crowd.
The number of deaths resulting from coronavirus is for lack of better words, is a minimal number when you compare to the number of people infected generally, globally now.
Yes.
What does that suggest? So that means that is curable, is not as bad. What does it attack in the human body, and how long before it perhaps leads to death?
Absolutely. The coronavirus is actually not as serious as people are projected. Yes, it spreads very fast. The case fatality so far has continued to drop. We've had now that even some people that were diagnosed, that were confirmed, are being discharged. They are getting well and they are leaving the hospital. That is to show you that it is not really as bad. We are not saying it's not bad, but it's not as bad as it's being projected by the press, by the by all the social media.
The social media is awash with all sorts of things.
Yeah.
We've had chloroquine would cure, so go ahead, spread yourself from head to toe with chloroquine or alcohol. We've heard that heat, it doesn't survive in a very hot region. Is that true, first and
You see,
foremost?
the issue is that coronavirus is a new infection. So one of the new viral infections. And generally, if you see some of the infections that are manifested in the past, like the H1N1 that occurred in the temperate region, they normally come during the cold, during the winter season, and you see naturally they begin to disappear as the winter begins to wane. So people think that probably why it happens like that is because of these infections don't really thrive in a very hot environment. It could be possible, but time is not enough to make that deduction, or we still see it as a possibility or a probability, let's say.
But certainly alcohol cannot be...
Alcohol is like a antiseptic generally, you understand? You can use it to how do I put it now? Is actually used commonly to kill bacteria and other things. These are viruses. It may help, but these are not treatments. Chloroquine does not treat. Ginger does not treat. This other one, garlic, does not treat. In fact, so many things.
Some argued and said they boost immunity, which is a good thing as a prevention.
The one thing is that in a disease condition, somebody with better immunity tends to overcome the infection better. And that's why the extreme of ages, the very young and the very old, are usually the victims of any new infection.
Because of low immunity.
Yes, it's just natural. That's the way it goes. You understand? But within a week, you don't consume a trailer load of garlic and think that you are protected. No.
Take us through an isolation center. What is it like? What is inside? What is expected? What happens in there?
The issue is a place where the person can be self-sustained. You can be there. The whole issue about isolation is that they don't want you to have contact with any other person, especially in a disease that is human to human transmission. It could even be through fomites. Like, I am isolated. I don't need to take my clothes out to be washed with other clothes. Because if it's a kind of disease that is transmitted through fomites, through other things, it could get to the other person. We are hearing now that another possible source of transmission could be through currency, through naira note, or through... When somebody is isolated, you keep them away from any physical contact. You pass the food to them, no handshake, no touching, no hugging, no kissing. No matter how dear you are to the person. And when you do that, the person will stay there the duration of the incubation period. And if after the incubation period, the person does not manifest with the disease, the person is discharged. Maybe you keep 2, 3, 4 days after. And if there is no manifestation of the disease, probably the individual does not have the disease. And the isolation center is, you are a suspect. It's not that you are manifested with the disease. When you are manifested with the disease, you are quarantined. You understand? You are quarantined, that you are kept away from everything. You are just there. You understand? The food is passed to you. They keep on giving you treatment, to see how you recover, luckily for most people.
Thank you very much, Doctor.
Thank you.
Thank you for watching this week's episode of the program. Let's continue the conversation online through the email address and Twitter handles on your screen. Also, be sure to share anything happening within your locality with us. I'd like to also remind you that you can view the program on youtube.com/channelsweb/videos. Thank you for watching. I'm Ibrahim Adra. We'll see you again next time.